Because Santa Claus might be a great candidate for some GLP-1s, you know? Cookies and milk. It can add some LBs. It's my pleasure to welcome to the show David Clement. He is the North American Affairs Director for the Consumer Choice Center. He's got a piece in the Boston Herald entitled "One Big Risk Remains in GLP-1 Boom." We will talk about that risk here in just a moment. In the meantime, David, welcome to the show. Appreciate you calling in.
Thank you very much for having me.
Of course. So let's get right into the article. You kick off the article with the holiday table jokes about Ozempic this Christmas season, with numbers like 12% of Americans already using these drugs, 35% considering using them. That's over 40 million people. So what is it that's fueling this massive shift from the GLP-1s being used as a diabetes treatment to a mainstream weight loss tool?
So I think it's twofold. The reason why it's really exploded is, one, the United States, like most modern developed countries, has a weight problem, and two, these drugs have been shown to be incredibly effective, and that's increasingly true. I mean, if anybody's listening who's a parent, I am one. The older you get, the busier life gets, the easier it is to let things slide, and if you can redefine your relationship with food, you are able to reset the clock in terms of weight. And so I think that's why so many Americans, when they were gathering for Thanksgiving and when they're going to be gathering for Christmas, are probably going to be talking about GLP-1s, whether jokingly or not. The interest in it is overwhelming right now.
Yeah, you also highlight a Cornell study that shows that households with a GLP-1 user are actually slashing their grocery spending by more than 5% in the first 6 months. So the side effects, or the ripple effects, I guess, are far-reaching. Not only might you lose some LBs, which is also just going to overall, help improve your health, but you could be spending less on food. So how are these drugs changing eating habits and shopping carts across the country?
Yeah, well, they're changing eating habits in the sense that people are just buying less of maybe some of the guilty pleasure foods that they otherwise would grab at the grocery store, because they're just not as interested in eating them. And then as with any kind of weight loss plan, obviously it's about your own personal habits. It's not a drug that magically makes you shed LBs if you don't do anything about it. So you see a shift, a more health-conscious shift in terms of what Americans are buying in households where someone is using a GLP-1. And so let's say a focus on higher protein meals, a focus on vegetables or salads, as opposed to some of those maybe high-calorie snacks. But what's interesting is, as Americans lose weight by taking GLP-1s, the ripple effect in the economy is incredibly widespread. I mean, think about the preventable diseases linked to obesity and the healthcare-related costs, whether those be your own private insurance or things like Medicaid or Medicare. The long-term impact on cost reduction is incredibly significant, because if you are able to, let's say, take off that 10 to 20 pounds, the things you avoid later in life are almost infinite in terms of the list of potential problems. And what I found the most interesting, which obviously makes sense when you really think about it, but it took me a second, was this could even potentially have an impact on the airline sector.
And that was sorry to interrupt. That was actually my next question, and I thought that this connection to GLP-1 use it did not cross my mind. But when you break it down, like you say, when you extrapolate the data, it makes a lot of sense. So how could GLP-1 use actually affect the airline industry? And we're not talking about the food they're serving on the plane. It affects them in a far bigger way.
Yeah, I mean, there was a Bloomberg report looking at just United Airlines. And if passengers on average were 10 pounds lighter, it'd be about $80 million in fuel savings. So that's just one airline. I mean, you multiply that by all of the airlines, and I mean, that is an incredible amount of money just saved on the gas that's being burned, getting people from point A to point B. And so, I mean, that's obviously nice for the airline companies, but as a consumer advocate, what I love in that is that offers more wiggle room to be competitive on prices, because you're reducing one of the major overhead costs in terms of operating an airline. And so, I mean, you take that and you start to multiply it by all of the other aspects of what Americans do on a given day and what the impact of potentially lighter weight could mean, and you just start to see this buildup of potential positive economic benefit across the economy.
Give you a little bit more wiggle room in that coach-sized seat as well if you're successfully using the GLP-1. So,
Yes.
might add a little comfort to the trip. Yeah.
True.
So the headline for the article talks about a risk factor that maybe is not considered by a lot of folks when they're considering GLP-1s. And there are risk factors to consider. Obviously, what you want to talk to your doctor, make sure that it's the right thing for you to be doing. But the explosion in counterfeit GLP-1, something that doesn't get talked about a lot. Senator Tom Cotton pushing Attorney General Pam Bondi to crack down on fakes incoming from China and Turkey and India. So what's going on? How are these fakes making their way into the country, and how can you as a consumer avoid them?
Yeah, so what we're seeing, I mean, when anything becomes popular, there are always bad actors who like to fill a void. And what we've seen here is like an increase in precursors entering the U.S. So these are the various components of the drug. One example was coming from unregistered entities in China. That obviously is unregulated in the sense that the Chinese distributor of those precursors, there's really no guarantee, one, what you're getting, and two, that it's the right medication and the right dosage. But part of the problem here is that essentially what Americans, when they're getting these counterfeit drugs, is they're having to mix them at home. And that is just a bad recipe for almost any medical intervention you might have.
Yeah, about the only thing I want to mix at home is a cocktail. I don't know if I want to be mixing up my own drugs on the kitchen table.
Yeah, let's not do that. Let's not be trying to make our own GLP-1 at home on the same counter where we're prepping the Christmas turkey. That's not that is a recipe for some uncomfortable health consequences. And this is the really tragic part, is that it's not just it's not a hypothetical. We actually have seen people taking these counterfeit drugs, and it's include pancreatitis, miscarriage, in some cases people even dying. And the thing is they're not dying because the actual drug is hurting people. They're dying because what they're getting is counterfeit and not up to the regulatory standards and not safe. And so it is good news that we have seen some pushback and actually, weirdly enough, some bipartisanship in the Senate right now to push the FDA to try and crack down on these unregistered entities, specifically from China, sending these precursors into the U.S. because we know that Americans want access to this drug, but it is incredibly important that you're actually using, after consulting with a doctor, using the real thing and not trying to whip up some GLP-1 cocktail in your kitchen.
So is your advice for folks that are interested in the GLP-1s, you would say, look, you need to go to your general practitioner, go to your doctor that you trust. And out here in the Coachella Valley of Southern California, these GLP-1s are very popular. We see billboards all over town, talking about, hey, it's cheaper here. We've got them here, a couple bucks a month. We'll get you taken care of. How do you know who's legit and who's not? You just stick with your regular doctor and don't trust these others? Or are these other ones, are they on the up and up as well?
Well, I would say try and stick with your doctor and your pharmacy, right? Try and deal with licensed medical professionals when you're trying to get a regulated substance like a GLP-1. And just remember, my kind of suggestion for consumers and patients would be, if it feels too good to be true, it probably is.
Oh, it's a theme on the show.
Right? If someone is like, call this hotline or join this Telegram group or this Reddit thread on how you can get GLP-1s for 1/10 of the price. Well, that buyer beware, because in almost all of those instances, what the person at the end is selling you is something that is completely counterfeit and has been imported from countries that have no care about your well-being and have no, and this is the important part, you have no recourse, right? So if an entity from China is sending in these medical precursors and something goes awry because they've sent you junk product, you have no recourse really as an American, where when you're dealing with these licensed and regulated professionals, one, they're not going to get it wrong. But two, if there were some nightmare scenario where there was, you actually have legal recourse to protect yourself as a consumer, as a patient. So my kind of call for anybody who would be potentially interested in some of those things is if it looks too good to be true, do your research and maybe trust that voice in your head that says, I'm not certain about this, and make sure that the conversations you are having are with the people who are trained to do so.
It's solid advice. I definitely agree. You want to do your research, make sure you're going through, legitimate sources, talking to your doctor, going through, jumping through all those hoops to make sure it's right for you and that what you're getting is actually coming from legitimate sources. David, I appreciate your time this morning. David Clement, North American Affairs Director with the Consumer Choice Center. His piece in the Boston Herald, One Big Risk Remains in GLP-1 Boom. We'll get it posted over at our Facebook page, our social media pages, so you can give it a look. David, where can folks find you on social media if they'd like to continue to follow your work?
Yeah, the Consumer Choice Center is the organization, and I am at David Clement on I still call it Twitter, but on X.
Well, I still call it Twitter as well a lot of the time, and I apologize. I've been mispronouncing your name. I've been saying Clement. It's Clement. I apologize, sir.
Oh, Either way, you're good. I'm not a stickler for that, so not a problem.
Well, my last name is Mozingo, so if I was a stickler for pronunciation, I'd be angry at people all the time. It's constantly mispronounced, but I appreciate your time this morning very much.
Thank you very much.